Good morning. Let me start by thanking Dr. Henry for inviting me here today to tell you about how BC First Nations have responded to the COVID-19 outbreak, and to thank her for her leadership during this outbreak and her commitment to protecting our First Nations people and their communities. I want to acknowledge that I'm here representing leaders and team members, especially a surveillance team from the First Nations Health Authority, who have done amazing work in challenging circumstances. I'm also pleased to tell you that thanks to an extraordinary response from our First Nations communities, the people FNHA serves have fared even better than the rest of the population in the face of this unprecedented challenge. First Nations Health Authority is unique in Canada in that through our long-standing partnerships with the province of BC and the federal government, we are able to link our First Nations client file, which identifies status First Nations people, regardless of where they reside in BC, and link that status with provincial data sets to provide a clear picture of the number of First Nations people who have been tested positive for COVID. From January 1st to June 14th of this year, just 87 First Nations individuals have tested positive for COVID-19. There have been 4 deaths. But right now, we only have 3 active cases in the province. Of the 87 First Nations individuals, 42 live on or near a reserve. This is out of more than 5,500 tests that have been done so far. The credit for this relative success must go to the choices our First Nations leaders have made to implement strong public health measures. Communities have made unnecessary travel very limited and canceled or postponed large gatherings that are central to their culture and way of life. The sacrifices made, some of them very difficult and painful, have paid off. The worst, which many anticipated and feared, did not happen. Transmission of the virus within and between our communities was kept to a very small number. Many band offices closed their doors and had their staff working on urgent matters remotely. Many communities stood up emergency operations centers, and some went into lockdown, restricting non-residents from coming into the community except for essential services. Work to assure safety and food security were important tasks at this time. Despite this success, however, this is no time to lower our guard, even as the province transitions and begins to reopen, to allow the gradual opening of schools and businesses and travel. First Nations continue to express concern about having non-residents on their territories and potentially bringing the infection to their communities. But we will continue to work with them to do what we can to prevent that from happening. The curve has flattened, but it has not flatlined. If we relax our precautions too quickly, we could see a surge in cases. And this is why FNHA's recommendations remain in place. Maintain physical distancing, wash your hands frequently, and avoid gathering in large numbers. We must continue to do this for a while longer for the sake of the most vulnerable among us, especially our elders, our language holders, and knowledge keepers. In the meantime, we continue to work with our partners to evaluate the work that we've done to strengthen our response for any future active phases. With our health system partners, we are facilitating expanded testing to anyone who needs one so that we're not missing clusters or outbreaks. This means anyone exhibiting COVID-19 symptoms can now be assessed and get a test, even in the most remote communities. We also recognize the unintended consequences of what we've done. For those individuals struggling with anxiety and depression and loneliness, which is happening to a lot of us in these difficult circumstances, remember that our First Nations history has shown us how resilient we are. First Nations have always adapted well in the face of adversity, change, and even tragedy. I know we can get through this by supporting each other, by holding each other up, and by doing it with loving kindness. In closing, I'd like to thank my team members, all our provincial health authorities, the Ministry of Health, and Dr. Henry for their firm support for our First Nations needs and their commitments to address them. Thank you very much.